Now we have Health Minister Dr Zweli Mkhize to talk to us about the latest events. Dr Mkhize, thanks very, very much for taking the time to talk to us.
Good morning, Leanne, and all the viewers.
I want to first start off by talking about what we're running as our top story in the news, that the SANDF officials are refusing to man the plane to fly to Wuhan for fear of their life, for fear of safety. Can you update us? Is there any truth to this?
We are not aware of this. We have seen it in the papers. I have last night the discussion very late in the evening with General Shoke. He had not been informed of such a matter. So we would want to wait for the SANDF to tell us that that's the situation. But let me just hasten to add that such a fear would be really unnecessary, because all over the world people are dealing with the issue of the coronavirus, and people are being treated. At the moment, more people have been treated and recovered than those who are still ill, particularly in China. And therefore, and there are also countries which have had a number of cases. They treated them and they completely recovered. So the fear is unfounded, but we will not be able to talk much about it, because the SANDF, the chief of the army, the minister, hasn't really said anything to us about it. But we really don't believe that there's a reason for any staff to feel unsafe. There are clear precautions that need to be taken, and that is enough to be able to secure everybody to come into contact with people and not even be infected.
So just again to confirm, as far as you know, things are still on track. You haven't got an update from the SANDF. The plane is ready and things are going to happen and the people are going to be evacuated, according to your information.
As far as my information is concerned, the people will be evacuated. I also want to emphasize the point that people are coming from Wuhan. None of them have been reported to be positive of the virus, and they are not sick. They are only just coming back because they're missing home, and they're being brought back because they are South Africans. And therefore, it's important for us to act in the interest of South Africans and help them to come back. And so we still want to urge even South Africans not to have any sort of fear and panic about people who are coming from China and Wuhan. Actually, that side of things has really been taken care of quite well. And so there's really no reason to panic and fear. I think it's important for people to know that with time, the coronavirus will be like influenza, where everybody knows you cough, you get treated, you come back, you'll be fine. But just that because this one is new and humans have not developed any immunity around it, it really has given us a huge fear. But that really should be settling.
Okay. Minister, let's talk about the first reported case here in South Africa. We, of course, saw you jumping onto it very quickly yesterday. Everybody talking out, the National Institute of Communicable Diseases, we just had them in the studio as well, trying to allay fears within South Africans that at this point seem to be very, very nervous about the spread, very, very worried that, you know, this is something that's going to spread fast and furiously. Again, let's give the message out. What is our standpoint? How are we handling this? Should we panic at this stage?
Yes, thank you very much for this. We should not be panicking, because there's a certain message we all are saying that we should not be panicking. Firstly, because it is very possible to pick up those who have got the virus, and therefore it's also possible to treat them, to isolate them. What is important for us is to be able to say, if we are concerned, let's take care of the concern through going for medical checkups, and also we have a toll-free number. I will just make sure that you get it so that it can be beamed, so people can actually inquire about their conditions. This is because we've activated our emergency operations center. So at the moment, the particular person has actually been taken into hospital. He's really not very sick. It's just that, of course, because the test is positive, we have to take them in for treatment. There is really no reason why people should be so worried about it. As I've said, this virus can be contained. The country has designated centers where people will be treated. There is a huge amount of alertness among the health workers, particularly public and private. In this case, it was the private sector that picked up the patient, and we have worked together, and the government laboratories have been able to confirm it through NICD. So there's really a good network to be able to spot a case and deal with it. But we must avoid stigmatizing people who are found to be having the contact with the virus, because we can't treat this and the person will be sorted out in a matter of days.
Yeah. Minister, I want to question you on this toll-free line, because this morning it was on voicemail, and it's been something that's been said that's a 24-hour toll-free line that is being manned 24 hours, and yet this morning I was driving to work and listening to colleagues on SAFM who were trying to phone into it, and it was on voicemail. Nobody was manning it. So big concerns there. I know you say it's there and available, but no one's answering. It's on voicemail.
Okay, well, I'm sorry to hear that, but let me work into it and investigate. Certainly, we will want to make sure that the line is available. The only issue was that in the previous days, the line was not available 24 hours because we had not diagnosed the case. But with those weaknesses reported, we'll go and correct the system. But thank you for informing us.
Please, Dr. Mkhize, I think that's vitally important. One of the other issues we need to discuss is the gentleman that came back to South Africa was asymptomatic. He got through controls. As you have said, they are in place at OR Tambo and at other ports of entry into South Africa. He, however, was asymptomatic. He had no symptoms. It was only when he came home that he started not feeling so well. How contagious are individuals that are asymptomatic? And this is the problem that I think we need to really focus on.
In general terms, the clinical presentation of any viral or bacterial infection is that when someone is incubating the virus, they tend not to be infective until they develop symptoms and have got signs which can be proven of the presence of the virus. So we would still want to take precautions to screen and check many of the people who came into contact with a particular patient. However, we don't believe that if someone is asymptomatic, the worry should be so high that because they've been exposed to the virus but they have not exhibited any evidence that they are already suffering from its symptoms, that it may actually be a problem. Unless new research comes about, at the moment I think it's important to just say we work on the basis that the man was asymptomatic, which is why he was able to cross through all the checkpoints. But when it develops later, it's on the basis that we say the incubation period can be anything from 2 to 14 days, and therefore that is the period within which people can develop signs, and someone can go up to 14 days without showing the signs. But we expect that they will be effective after they've actually got the virus incubated and is already starting to develop signs in them.
Yeah, so that is a concern, is that people that do have it don't show the symptoms, but they are still contagious, and that is the fear of this coronavirus. So once again, the big advice to people: wash your hands, take vitamin C, monitor yourself. If you're not feeling well, get tested, get checked. Is this that same advice that you're giving to all South Africans? Let's again put that out there, let people get the best advice possible.
Well, certainly, I think it's important to say this is a person-to-person infection. So if people have been, I think firstly people must just make sure that there's good hygiene, washing hands. When you cough, you should cover your mouth with a handkerchief or a tissue, or cough through your elbow so that it doesn't spread to other people. And, if people have got someone who might be coughing, having symptoms, if you stand about 1.5 meters or so away, the risk of a droplet infection is minimal. But if you feel that there are symptoms, or you're feeling fever, you're feeling a sore throat, you're having a cough, all of these things, just seek medical assistance. We will start the number up, the toll-free number, so that you can check, in a chat before you even go out there. If you suspect somebody might have been in contact with the virus, it does not make them, or it does not make you already to be infected by simply being in touch with them. We can check that. But those who are contacts will be checked. Those who are contacts of contacts, in other words, someone else was with the patient, and then that person, the third person, is not necessarily at risk until someone is already infected. So we want to send this message across, because we will need the cooperation of the public firstly to reduce the fear, the panic, the stigma around this matter. We also want to appeal to the media to stop harassing individuals. We didn't announce the names, we didn't announce the village, the suburb, the town, but the media has been calling non-stop to the homes of the individuals and to the schools and to everybody. I think that the media is also going to create more panic by everyone phoning and harassing. People are now terrified because they get so many people calling, and yet we just need them to get the assistance of those who come from the department who will be able to manage the situation around it. I just want to show the public we really do want to work together with the public, but we believe that this can be contained better if everyone just works with us and we don't have a problem. We'll be addressing some of the teachers, the health workers, so that the public should know that this is going to soon become one of the normal diseases that we're going to deal with on a day-to-day basis. It was a matter of time that it came to South Africa.
Yeah. Minister, just finally, as we wrap up the conversation, I could keep you here all day, but I do know that, you know, you need to move on. But the reality is that this is a country that unfortunately struggles with very high rates of HIV, people that do have AIDS, people that have got TB. Obviously, extra precautions need to be put in place for those individuals if they are infected with the coronavirus. Because that, again, I'm not sure if we know the consequences of anybody that have got those and then is put in direct contact with coronavirus. What happens then?
Well, we don't have any specific evidence that there is a specific correlation of coronavirus, HIV, and so on. But I think on simple basics, we would really be concerned about it. And therefore, we want to do everything in our power to make sure that we protect as many people as possible and that we act quickly to reduce the risk of anybody, particularly those who might be immunocompromised, coming into contact with the virus, or if they have, so that it must be treated very early. So we'll keep watching on all of these. Although at the moment there's no direct evidence, but we think that it's important for us to always be looking out for all sorts of risks that are possible.
Yeah. Minister, we thank you so very, very much for your time. That's our Health Minister, Dr. Zweli Mkhize, updating us on the coronavirus. Now, you heard the Minister. They are going to work on that toll-free line. Here it is. It's not working, though. We've tried. I've got Sakina putting it on speed dial. She's already phoned it 3 times, still going to voicemail. We've brought it up with the Minister, but I want you to give you the number anyway. Here it is, 0800 029 999, and that's the toll-free line. It's a 24-hour hotline, apparently, and you can get information from there. But I can tell you now, it isn't working. So let's hope the Minister works on that as a matter of urgency.